Hello guys, welcome back to my YouTube channel. I am Divya, CPC certified medical coder, and today I'm going to explain the last two topic of the musculoskeletal system, that is hardware removal and the excision of the soft tissue. And one of the most important topic that is in spinal ortho will there will be another playlist for it. So without any further delay, let's get started. Our topic is that is an hardware removal and the uh, excision of the soft tissue. Okay. So guys, what do you mean by hardware removal? What does hardware means? So the hardware is nothing. This is a device. Okay. And what are these devices? These are the plates, screws. It, these are the plates, screws, nails, rod pins, metal band, external fixator, etc. So, it is a surgical procedure in which the orthopedic surgeon removes the previously implanted fixation device after the fracture healing or because of the complication. Okay. For example, if the patient having a fracture there, okay, and there is an fixation of the implantation will be there, okay, the device has been fixed there, okay, and after some time that fracture got healed and the patient need to remove this device. So he'll come to the hospital and the surgeon will remove this device. So simple, this is an removal of the implant, previously implanted device, or the device which is implanted having some complication, having some infection. Due to this, the hardware removal should be done. Okay. So coming to next, that is why hardware removal is done. As we previously discussed, that is due to the pain or irritation from the implant, the hardware removal will be done. Due to infection, due to the broken or the loose implant. For example, if the implant is if the implantation is done and the implant got breaked or loose, and due to this, the hardware removal will be done. As we previously discussed, that is a fracture heal. After the fracture healing, the hardware removal will be done. Due to the metal sensitivity in some patient or due to allergy, the hardware removal will be done. And need for the revision surgery also. Okay, before arthroplasty, before repeat fixation, before corrective osteotomy. For these all purpose, the hardware removal will be done. Okay, coming to next, that is what will physician do during the hardware removal? What is the criteria? What will physician do actually in the surgery? Okay, so first of all, the physician will prepare the patient by giving the anesthesia. Okay, after he will give the incision, he will do the incision and expose the hardware. Okay, and whatever the hardware, he will remove that area, and after that he will check that area, like he will inspect the bone, and he will check the fracture has healed and the bone is inspected for the infection, losing or the defect, and the irrigation and the closure has been done. Okay, so in the example you can see here, that is, and physician will first prepare the patient area where the hardware removal has been done. After that, he will also prepare the skin. He will give the incision here. And for example, you can see here there is a scar, previous scar, and he will give incision here and expose the hardware. You can see here the hardware is there. And he will remove gently that hardware, that is the screws, and and removal of the plate or implant. And after that, the irrigation and the hemostasis and the bone closure has been done. Okay. So this is an image representation of the hardware removal. So coming to ICD, before the that is OP report, before doing the OP report, we have to know the ICD and the CPT. So ICD, like a routine orthopedic aftercare following hardware removal, that is in Z47.2, mechanical complication of the internal fixation device T84 series, and infection due to the orthopedic implant T84 series also. And so In the navigation, we'll see how these codes were navigated. So simply we can say that that is hardware removal is surgical procedure performed to remove the previously implanted orthopedic device, that is in plates, screws, rods, when complication occur and due to the pain, infection, implant failure, irrigation, restrictive movement or the patient preference, the patient condition is essential before the removal. And when performed appropriately, hardware removal can relieve the symptoms and improve the function and reduce the complication. Okay, so these were the CPT. We can see that is 20670, 20680, and 20694. Okay, so what this CPT says, that is a removal of implant superficial, and this superficial is distance and depth of the skin. Okay, example buried wire or pin. Example K wire removal, small buried pin removal. Usually considered as in minor procedure. Okay, so this CPT code comes in minor procedure. Coming to next, that is 20680. That is removal of the deep implant. Deep implant, we can say that the muscle or the bone level. Okay. Example, buried pin, screws, metal, pan, nail, rod, or deep plate. Example, tibial plate removal. So what tibia is? Tibia is a bone. So we can say that it is a deep implant, removal of the deep implant. Femur, clavicle, radius plate. So these were the bones and these were the deep. Okay. And now coming to 20694, that is removal of the external fixation system under the anesthesia. Example, ear frame removal and the external fixator removal in the under the anesthesia. Okay. So coming to next. So what is the coding criteria? Coding criteria, we have to check whatever the procedure is performed. And what are the surgical approaches? We have to check the types of implant, whether it is plate, screws, rod, or nails. We have to check that. And we have to most important check what is the depth of the implant, that is superficial or deep. Okay. And the anatomical site is very much important. We have to also check the anatomical site. And coming to next, that is laterality also important. Which side has been there? Hardware removal has been done. And what is the reason for the removal? Whether it is pain, infection, prominent hardware, broken implant, healed fracture, elective removal. And we have to check whether the hardware completely removed or the partial removed. Okay, coming to next. And we have to also see check that was the another surgery is performed along with the hardware or not. Example, along with or if that is an orthoplasty, osteotomy, bone graft, revision fixation. So important note, if hardware removal is performed as a part of another procedure on the same site, it may be bundled. Okay, depending on this CPT and CCI rules and documentation. So no need to give any anatomical modifier to these CPT code. Okay, what are these CPT code? These CPT codes are 20670, 20680. We do not have to give the modifier. Okay. So, and we have to check if the hardware is performed if the hardware removal is performed as a part of another major procedure on the same site, then we do not have to code the hardware removal code. Okay. So this is an important note. Coming to next. So deep versus superficial, maximum we see the OPD port 20670, 20680. Okay. So superficial means that is near the skin surface. Okay. And there will be a minimal dissection and the buried pin or K wire. And deep means 20680, the located beneath the muscle or the deep soft tissue. And there will be an extensive dissection and plate, screws, rod, intermedullary rod has been used. So there is one OP report for the hardware removal. So let's see what's that. So pre-operative diagnosis, that is a painful retained hardware right tibia. Post-operative same procedure performed removal of the deep orthopedic hardware, that is plate and screws, right tibia, anesthesia, general anesthesia. So here is an diagnosis is painful written hardware right tibia, and procedure is the deep hardware removal. But we'll see the description. Okay. The patient was brought to the operating room and placed in the supine position, and after induction of general anesthesia, the right lower extremity was prepped and wrapped in the usual sterile fashion, and the previous surgical incision was reopened, and the dissection was carried down to exposure of the hardware. And the tibial plate and all the screws were identified and removed without difficulty. And the fracture site was inspected and found to be well healed, and the wound was irrigated with normal saline hemostasis was achieved, and the incision was closed in layers. And a sterile dressing was applied, and the patient tolerated the procedure well and was transferred to the recovery room in a stable condition. So we'll see the navigation. First of all, let's understand that because the general anesthesia given, what are the site? The site was the right tibia. Okay, the site was right tibia, right lower extremity, that is on right tibia, and the third one, that is on tibial plate and the screws. So the hardware is screws and plate, and it is from not the superficial, it is deep. Why? Because the tibia is the deep bone, it's in bone, so bone comes in deep level. Okay, so uh, let's do the navigation of this procedure. Okay, so first, what are the procedure is painful written hardware. Okay, so we'll navigate by the word, that is pain. It's pain due to device. Okay, due to device, because it's a device, so device implant gap, so due to device. After that, we have to see the joint prosthesis because the tibia is in joint, and initial okay, so this one is the ICD for the painful written hardware, right tibia. Okay, and coming to the procedure, that is an hardware removal from the deep. Okay, so we'll navigate by the word, that is removal of the hardware hardware okay, removal of the screws or plates. It's on the which side? Deep versus superficial. So it's on deep. So this one is the CPT code for the this OP. Okay, 20680. That is an removal of the deep implant. You can check here. For the removal of the implant superficial 20670 and the deep 20680. And here is a parenthetical note, that is for removal of the sinus tarsi implant, we have to use the this series codes. Okay, 0510T. Removal of the reinsertion of sinus tarsi implant, we have to use this CPT code. Okay, so coming to next. Okay, so again that is an OP report, one OP report from the hardware removal. That is an retain buried K wire left index finger, and the post-operative also same. Procedure performed the removal of the superficial implant, buried K wire, left index finger, and anesthesia is local anesthesia. So here the pre-operative diagnosis is retained buried K wire, left index finger. But we have to see the description. The patient was brought to the sterile fashion after the administration of the local anesthesia, and a small incision was made over the previous pin side, the buried was irrigated, hemostasis was achieved, and the skin was closed with a simple suture, and a sterile dressing was applied, and the patient tolerated the procedure well and the discharge in stable condition. So here you can see that there is a small incision, local anesthesia done, and there is an buried K wire which was identified and removed with the minimal dissection, and it's an superficial because the minimal dissection has been done, and the location, that is, and reason was left hand, left index finger. So we'll navigate this. Okay. So patient coming for the encounter for the buried cave. So we'll navigate by the word encounter for the, we have to spell, that is removal. Okay. After that, we have to check, we have to again spell. It's an internal fixation device. Okay. After that, we have to check other unspecified. So this one is the ICD code for the encounter for the removal of internal fixation device, Z47.2. Now, removal of the superficial implant. Okay. So buried K wire and it's an minimal dissection. Okay. So again, removal of the hard pair, internal, it's an hand. Other, it's a superficial 20670. Okay. So this one is the CPT code for the remote, and we do not have to give the any modifier along with this. Okay. So coming to next, that is our excision of the soft tissue. So in the excision of the soft tissue, so what do you mean by the excision of the soft tissue? What this procedure is? So what are the soft tissue first? The soft tissue includes the fat, muscle, fibrous tissue, tendon, fascia, and connective tissue. Okay, and it is a surgical procedure in which the physician will cut out and remove the abnormal soft tissue lesion or the mass from the body. For example, if in the patient body soft tissue, if there is an abnormality or abnormal lesion or mass, then it should be removed. So the excision of the soft tissue is the surgical procedure in which physician will cut out and remove the abnormal soft tissue and mass from the body. And the removed tissue is often sent to the pathology, and they determine whether it is benign or the malignant. Okay. So coming to next, why it's done? It's done because of the lipoma, cyst, soft tissue tumor, fibroma, painful or enlarging mass, infection or abscess, suspicion of cancer, or the cosmetic concern. So what this lipoma is? So lipoma, we can say that it is a non-cancerous tumor fat tissue. Accumulation of this, so this is an lump, okay, and due to the accumulation of fat and it's mobile, so it's an lipoma. Okay, it's unmovable and usually painless lump under the skin. You can see that here is a bump in the skin, bump in the skin, and this one is lipoma, and it's not painful. Okay, common in the neck area, shoulder area. Okay, so coming to ganglion cyst, what the cyst is? What cyst is? So cyst is a nothing fluid filled sac, okay, around the joint or the tendon cyst. Okay. So what do you mean by soft tissue tumor? Soft tissue tumor is an abnormal growth arising from the soft tissue such as the fat, muscle, fibrous tissue, and blood vessels or the nerves. Okay. And due to the cosmetic concerns that you can see here, that is a patient having the abnormality in the her nose, and after the surgery, you can see here. So coming to next, you can see here, this is an skin. This is an outer layer of the skin, which is known as the epidermis, the middle layer that is an dermis and the true skin, and the third layer that is an hypodermis. And you can see here the muscle, fat or skin. Okay. So coming to next. So what does the physician will do? So first, the physician will prepare the patient and give the anesthesia and make the incision over the mask. And he will carefully dissect the soft tissue and remove the lesion completely and control the bleeding and irrigate the wound and the close the incision with suture or the staple and send the patient for the pathological examination. Okay, coming to next. So most important, the types of soft tissue excision. Okay, excision of lipoma, ganglion cyst, fibroma, soft tissue tumor, neuroma, scar tissue, benign or malignant soft tissue mass. So already we have discussed what is lipoma and ganglion cyst and the fibroma, soft tissue tumor. So what do you mean by neuroma? So neuroma is an benign growth or the thickening of the nerve tissue, and it can cause pain, tingling, numbness, and burning sensation. Okay, scar tissue. Scar tissue is nothing but it is a fibrous tissue formed during the healing process after the injury or surgery or inflammation. And what do you mean by benign or malignant soft tissue? It's a non-cancerous lump in the soft tissue. It grows slowly, remain localized in the and does not spread. Okay, the benign soft tissue mass does not spread to the other part. But coming to malignant, it isn't cancerous, and benign is a non-cancerous. But malignance is a cancerous tumor arising in the soft tissue, and it can spread over the other part of the body. Okay, so malignant is dangerous because it is a cancerous. And coming to next, ICD. Okay, so lipoma of the trunk, that is D17 series, lipoma of the upper limb D17.2, lower limb D17.2, benign connective tissue D21 series, malignant soft tissue tumor C series, and the localized swelling mass R series, CPC cyst L series. So we'll navigate in the while doing the operative report. And coming to the CPT, based on the location and based on the size and based on the depth of the skin, there are different CPT for the excision of the soft tissue. For example, upper arm elbow, 24,000 series. Okay, 24,000 series excision of the soft tissue tumors upper elbow subcutaneous level. Okay, and 3 centimeter and 3 centimeter or greater, that is 240/73 or 240/75, that is an less than 5 centimeter and greater than 5 centimeter, you can see here. And forearm wrist, that is an subcutaneous, less than or equal to 3. So you can see in every CPT code, different codes are different, and there is some different, that is an size of the tumor, and the levels, that is an subcutaneous and the subfacia. Okay, so it differ level of the skin, okay, depth of the skin, and the size of the tumor. Okay, next for the hand or finger, same, soft tissue tumor, subcutaneous, less than 1.5. Okay, 26113, subcutaneous, greater or equal to 1.5. So similarly in the thigh region, foot region also, and the leg, ankle. So these one is the CPT code for the excision of the soft tissue. Coming to next, coding criteria is very much important. That is an anatomical location, as we previously seen. The anatomical location is very much important. Which location the removal of the excision of the soft tissue has been done, and we have to see the depth of the tumor, and depth of the tumor is very much important. That is an subcutaneous, subfacia, intermuscular, deep under the skin. So one more thing I'm going to explain here. So here, this is a normal healthy skin, and this one is the outermost layer, that is an epidermis, you can see, and the second layer, that is an dermis, which is a true skin, true layer of this Okay, and the below the subcutaneous tissue there is one layer that is known as fascia, and it's covered the muscle. So the muscle outer layer that is known as the fascia. Okay, and between the fascia and subcutaneous there is some deep fascia, or we can say. So I'm going to explain what. So whenever in the OP, sometimes the subcutaneous level is not directly given. Okay. So in place of that, up to fascia, down to fascia, up ever fascia, until fascia, superficial fascia. So this will come under the subcutaneous level. Okay. Learn this. And through the fascia, we can say that the through the fascia means subfascia or the muscle. And below the fascia, subfascia, intramuscular, that is within the muscle, is the muscle or the deep level. So it's very much important. You can learn this. Okay. Coming to next. So the third criteria is the size of the tumor. And the fourth criteria is complete excision. Okay, whether the excision is complete or partial, we have to see that. And the fifth one is the type of this soft tissue, whether it is lipoma, soft tissue, or neuroma. We have to check this all. So one OP report for the soft tissue excision, that is an preoperative diagnosis, soft tissue mass, left forearm, post-operative, that is and the same, and the procedure excision of the soft tissue tumor, and the operative report, that is an after local anesthesia, a longitudinal incision was made over the left forearm mass, blunt and safe dissection was carried out to the subcutaneous tissue, and the 2.5 centimeter encapsulated lipoma was identified and completely excised. And hemostasis was achieved, and the wound was irrigated, and the incision was closed in the layer, and the specimen was sent for the pathology, and the specimen confirmed as the lipoma. So in the preoperative diagnosis, that is a soft tissue mass, it is excised completely and sent to the specimen, sent to the pathology lab, and it confirms the lipoma. So we will code the ICD for the lipoma, soft tissue mass lipoma. Okay. So we will navigate this. Okay. So we will navigate the soft, will give the lipoma, then specified it's an arm area. Okay. It's on left side, D1722. So this one is the ICD for the soft lipoma. Okay, D1722. Coming to procedure. So what procedure is? What procedure is? So here the area is left forearm. Okay, and the type of soft tissue is lipoma, and the size is 2.5 centimeter, and it's completely excised. Okay, so we will navigate this. Excision. Excision of the soft tissue tumor, and it's an excision of the forearm and the wrist. And after that, the depth is what are the depth? Depth is very much important. So what are the depth? This one is the subcutaneous. Okay, so subcutaneous, and it's less than 3 centimeter, because 2.5 here. No, no, 257. So this one is the CPD for the this OP report. Okay, so we have covered the all topics, and one rest topic, that is and the arthrodesis, spine arthro. So we'll give the another playlist for this. So thank you guys. Subscribe my channel.